All right, folks. Today we're diving into a topic that blends science, medicine, and quite a bit of controversy. Medical cannabis and its potential in treating cancer. It's like, you know what they say? Where there's smoke, there's fire. And in this case, I think there's a lot of intrigue and confusion surrounding it.
That's really interesting. So, are they saying that, like, cannabis can actually help with the symptoms of cancer? What's the actual science behind that? Because, I've heard people talk about its benefits, but it feels so, wild.
Absolutely. And it does sound wild at first. But here's the thing. Cannabis contains compounds called cannabinoids, which can interact with the body's endocannabinoid system. This system plays a role in regulating pain, mood, and, surprisingly, how we experience nausea. Imagine your endocannabinoid system as a gardener. It's trying to maintain the overall health of your garden, which is your body. Sometimes, that gardener needs a little help during tough times, like when you're undergoing cancer treatment.
Wow, that's such a cool way to think about it. So, is it like a natural pain reliever then? I know some people who use it recreationally, and they always say it helps them relax. But I've never thought about it as something that could, help with actual medical issues.
Exactly. Some people refer to it as nature's way of providing relief. But here's where it gets even more fascinating. While there are anecdotal stories from patients saying it has really helped them, the scientific community is still grappling with large-scale clinical trials to, really confirm those benefits. It's like trying to make a huge puzzle without having all the pieces in front of you.
That's such a good analogy. It's frustrating. I've heard about so many people who swear by it, but how do they get to that level of trust in cannabis if the research isn't fully there yet?
Great question. Trust, I'd say, often comes from personal experience. People who find relief from symptoms can be quite vocal about their experience, and they form communities that share those stories. It's a bit like those group chats you have with your friends when someone discovers a new restaurant. You hear their raving reviews, and suddenly you're curious and want to try it too.
Right, I totally get that. But isn't there a concern about the legality and regulation? How does that play into this? It feels like a real minefield.
The legality piece is definitely a significant part of the puzzle. In some places, cannabis is entirely legal, while in others, it's still treated more like a taboo. This disparity can make research challenging, as some scientists may not have the legal clearance or funding to carry out their studies. It's like trying to run in a marathon, but only being allowed to train in a small neighborhood park.
Haha, that's a perfect image. Do you think the push for legalization might change that? Once more states or countries recognize it, could we see more groundbreaking research?
For sure. As legalization spreads, we're likely to see more funding and increased willingness from institutions to study cannabis in depth. It's akin to unlocking a door that's been shut tight for ages. Suddenly, there's a whole new world of exploration available. However, it's not just about research. It's also about creating accurate guidelines for its use in medicine, so patients can receive safe and effective treatments.
Wow, I'm really excited to learn more about this. Definitely makes me wonder how different the landscape of medical treatment will be in the future, especially for something that has been so misunderstood.